Says it is live. Bear with me, folks. I'm trying something new today. I checked this at first, so hopefully this works. Look, sweet. YouTube looks good. Let's just make sure this works on Facebook. Oh, whatever. Let's just go ahead and get started. Yeah, looks good. This is pretty cool. All right, I'm just going to go ahead and get started with the typical, which is reviewing two different news sources, the first of which is news that is pertinent to pharmacy from ASHP's daily briefing. And then the second one would be news from AMIA, which typically pertains to informatics, policy, public health, things like that. So let's go ahead and get started with pharmacy news. I'm going to share my screen. I have it pulled up. Today is, this is today's news. ASHP Daily Briefing. We'll just go ahead and walk down through the news that we have today. Let's see. All right. Let's see. What's up, Haradrum? This is pretty cool. It's like connected to like Facebook and YouTube at the same time. So maybe this would be like a broader view than my typical audience. Anyway, so leading the news for today. States warn unused J&J COVID-19 vaccine doses could expire soon. New York Times reports state health officials are growing increasingly concerned about whether Johnson & Johnson COVID-19 vaccine doses may expire this month, warning they could go to waste if they go unused in the coming weeks or not sent elsewhere. White House pandemic advisor Andy Slavitt said on Tuesday at a news conference that the federal government was encouraging governors to consult with the FDA on storage procedures as the agency examines how to possibly extend the shelf life of the vaccine. Wall Street Journal says the stockpile doses are the result of the decision to temporarily suspend use of the Johnson & Johnson shot in April due to a rare blood clot risk. Yeah, I wonder how much vaccine are they going to lose from this? J&J has said it is conducting ongoing stability assessment studies that could allow it to push out the expiration dates for its one-shot vaccine. Yeah, I'm kind of curious, like how much money is actually being lost. I tried clicking on the article, but it looks like it's behind a paywall, so I guess we're not going to find out. We'll move on to the next news. Oh, look at this, pretty awesome. From ASHP, Linda Tyler sworn in as new ASHP president. Linda Tyler is super awesome. I got to work with her back in when I was a PGY2 resident at the University of Utah. Pretty awesome news. Other COVID-19 news. COVID-19 vaccines may be available for young children in U.S. by fall. New York Times reports that the coronavirus vaccines may be available in the fall for U.S. children as young as 6 months. Wow. Drug makers say Pfizer and Moderna are currently testing their vaccines in children under 12 years and are expected to have results in hand for children aged 5 through 11 by September. Reuters reports Pfizer on Tuesday said it will begin testing its COVID-19 vaccine in a larger group of children under age 12 after selecting a lower dose of the shot. It'll be interesting news. I think some of the preliminary data I've seen so far has been pretty good on children. So this is pretty young, though, as young as 6 months. I guess we'll see and wait to see how the data comes out for those kiddos. Dennis says, just me and you hanging out. There's get Dennis in here. Oh, not Dennis, Wilson. That's cool. So this looks like I can see where they're from. So can you actually see my entire screen? Oh, I think you can see my entire screen. Meant to share just the ASHP news. There we go. Oops. Anyways, keep going there. COVID vaccination rates plummet in several states. Reports on his website. COVID-19 vaccinations have slowed to a trickle in some states since reaching the peak of daily vaccinations on April 1st. CNN adds, over the past week, an average of roughly 560,000 Americans have been vaccinated each day. I mean, one would expect that vaccination rates would plummet at some point, right? Or reach some plateau. But Not too interesting. Biden administration says Delta COVID-19 variants accounts for 6% of new infections in U.S. Washington Post reports the highly transmissible Delta coronavirus variant first identified in India accounts for 6% of new infections in the United States, and the Biden administration said Tuesday. Director Dr. Anthony Fauci revealed the extent of the variant's push into the United States, but said it appears to be slowed by vaccines. That's good news. U.S. appears unlikely to meet Biden's July 4th COVID-19 vaccination target. The AP reports the U.S. is unlikely to meet President Biden's target to have 70% of Americans at least partially vaccinated against COVID-19 by July 4th. Nearly 16 million unvaccinated adults need to receive at least one dose in the next 4 weeks for Biden to meet his goal. But the pace of new vaccinations in the U.S. has dropped to about 400,000 people per day, down from a high of nearly 2 million per day 2 months ago. If you sit back and you think for a second, like, how likely are we to even reach that goal of 70% of Americans, considering how divisive the U.S. is? And I would assume roughly 50% of Americans would not want the vaccine in general. So that seems like an unrealistic goal anyways. Dennis says he saw everything. Oh, well, too bad. Hopefully there's nothing sensitive in there, which I don't actually think so. It's just you guys can see my Restream setup. That's all. And my Discord, but Discord's whatever. WTO panel mole easing IP protections for COVID-19 vaccines reports that envoys from World Trade Organization member nations are taking up a proposal to ease patents and other intellectual property protections for COVID-19 vaccines to help developing countries fight the pandemic. The two-day meeting of a WTO panel opening Tuesday will consider a revised proposal presented by India and South Africa for a temporary IP waiver on coronavirus vaccines. It's a very interesting news article. I know they've been talking about that for a while, but I don't have too many other thoughts about it. It's tough, right? Like, you have an incentive to develop brand new IP for vaccines, and then you get pressure to share it with everyone, which shouldn't be the case. But at the end of the day, it is a business, so I understand both sides there. Drug approvals, don't care. Regulatory, don't care. Health coverage and access. Walmart Health preparing to offer telehealth in over a dozen states. Why is this? Is this like something new? Healthcare IT News reports the medical group for Walmart Health has filed paperwork to do business in more than a dozen more states. And a spokesperson told Insider that the moves are not related to physical clinics. Instead, Healthcare IT News adds this preparation regards the company's pending acquisition of telehealth vendor MeMD earlier this year. The spokesperson said, "We've expressed our interest in offering telehealth via an acquisition that is pending regulatory clearance, and these filings are related to that effort, not physical Walmart Health locations." So that's interesting. So I guess telehealth is new for Walmart, and good to know. Seems like they might be a little late to the game, considering most of 2020 was on telehealth. Health business. Biogen says it will start shipping recently approved. No, I don't really care. Alzheimer drugs. Don't care. Also in the news, majority of average healthcare premium dollar dedicated to prescription drugs. I should read this again. Majority of average healthcare premium dollar dedicated to prescription drugs, hospital costs, research indicates. Majority of average healthcare premium dollar goes towards prescription drugs and outpatient and inpatient hospital costs. According to AHIP's most recent research that examined 30 commercial healthcare insurance providers' financial statements between 2016 and 2018, the largest chunk of the healthcare dollar went towards prescription drugs. Not a surprise, with 21.5 cents dedicated to payments for outpatient prescription medications and prescription medications administered in a physician's office or clinic. Outpatient hospital costs accounted for 19.8 cents, followed by inpatient hospital costs at 19 cents and provider visits at 12 cents. I'm assuming this is like per cent. Not surprising, right? It seems obvious considering the insane levels of drug costs in our country, including just like healthcare costs in general. Tuesday's leading stories. Nothing really catches the eye. Cool. Let's go ahead and move on. What does telehealth mean for pharmacists? I don't know, just calling for ambulatory clinics and stuff, like chronic disease management, something like that. I don't know what's the difference between like what we already do, like calling people to do those kind of things versus like telehealth. Like, I don't know. I don't care. Anyways, let's move on to more interesting news with informatics. Let's see, share screen. This is usually the more interesting stuff. So AMIA's daily download, which is more interesting news for me because pertains to clinical informatics, bioinformatics, population health, top news, and social media highlights. So let's see what we got. Delta variant, we already saw this already in the other one. COVID-19 vaccines, this was talked about as well. PwC, health costs to likely go up 6.5% in 2022. Again, not a surprise, as systems invest in supply chain digital health. Healthcare costs are likely to go up by 6.5% next year as the COVID-19 pandemic is likely to continue to impact spending into 2022, a new report finds. What I find interesting also about that is that one of the articles I read earlier today about health information technology is that one of the goals of health information technology is to reduce healthcare costs. But one would think like with the implementation of it, it's just constantly increasing. Perhaps we'll reach some plateau at some point where it would start to decrease, but I don't know. In general, it is expected that healthcare costs will go up 6.5%. I don't know, this is like a total GDP or something. Sam says he cares. Sam, we need more people like you out there. Good man, you're a good man. VA awards $725 million EIS contract to AT&T for data network modernization. The Department of Veteran Affairs has awarded a 12-year, $725 million contract to AT&T to modernize the agency's IP-based data communication platform and drive mission outcomes. This will become sad news for everyone that has sold the AT&T stock in the last few weeks after they dropped their dividend. Wonder if their stock price went up after this. Nice little contract here. Why is this news? I don't know. I don't find that super interesting. Clinical informatics. Execs accelerate health IT innovation, digital health transformation. It's a lot of words. To meet the needs of post-COVID-19 care delivery, health IT executives are accelerating digital health transformation through technology infrastructure development, comprehensive health IT training, and shared data platforms, according to Accenture's 2021 Digital Health Tech Vision Report. I don't even know what to make about that. It's just not a lot of useful information. 3 ways EHRs get it wrong and hinder physician well-being. Despite their advantages over paper records, EHRs can add to physicians' clerical burdens and worsen their burnout symptoms. To cut through the clutter, one physician expert identifies some of the productivity pain points that often contribute to administrative burdens and physician burnout. Again, not news. They've been publishing on physician burnout since we implemented EHRs in the early as like 2009 to 2010. So I don't think there'd be anything new that this adds. Knocking on the digital front door. Patient portals have become a more important patient engagement tool than ever during the COVID-19 pandemic, not only serving as the digital front door for healthcare provider organizations, but also as the primary way for communicating with physicians and nurses and even receiving care through telehealth. Patient portals. Cool. Not a surprise, right? Like you would expect so. Patient portals to be primary engagement during the pandemic. Cool. Zooming into the State House, nursing home residents use new digital skills to push for changes. Patty Bausch isn't a Medicaid expert, lawyer, or medical professional, but she still thinks Connecticut legislators need her input when they consider bills affecting people like her, the roughly 18,000 residents who live in the state's nursing homes. What exactly is this more about? Let me take a look. Virtual lab equipped with internet. The combination of a virtual legislature and nursing home residents equipped with internet access has created an opportunity most nursing home residents rarely have to participate in their government up close and in real time. After Bausch signed in to watch the hearing, a committee clerk signaled when her turn was next. She had the spotlight in just 3 minutes to make her point. Hey, this is awesome. That's super awesome. Get nursing home residents involved in policy making. Looks like this one is just providing something as simple as internet access and logging into these local events to have a chance to speak up. Good thing. All right, what else do we have? Bioinformatics and data science. Let's see. So how COVID-19 can lead to diabetes. Along with pneumonia, blood clots, and other serious health concerns caused by SARS-CoV-2, the COVID-19 virus, some studies have also identified another troubling connection. Some people can develop diabetes after an acute COVID-19 infection. I think I've seen a lot of this before, right? Where there's some type of association. There's been plenty of discussions linking or associating diabetes and COVID-19, but I don't know, that's not as interested in how that happens. NIH earmarks $38 million for consortium studying polygenic risk scores in diverse populations. The National Institutes of Health said on Tuesday that it will provide $38 million in grant funding over the next 5 years to fund a consortium that would develop improved methods for using polygenic risk scores to predict disease in diverse populations. Cool. What is this section about? Bioinformatics and data science. New methods enable simultaneous single-cell analysis of chromatin. That's not interesting. The API revolution that's securing the future of virtual healthcare. When the pandemic hit, the use of telehealth, which until then had been only lightly used across the healthcare ecosystem, soared. CDC found that the number of telehealth visits increased by 50% during the first quarter of 2020 compared with the same period in 2019. These are relative increases. It's not as high. I'm kind of curious about this article, though. Let's see. Let's try and share this one. Perhaps we'll find something interesting in this article. Let's see, where is it? Here it is. All right. Here's the article. API revolution that's securing the future of virtual healthcare. This boom has reviewed the overwhelming need for industry standard APIs, software solutions, and hardware bundles to help telehealth platform vendors and healthcare providers rapidly deploy virtual care services. The pandemic created the opportunity for this mode of care to gain traction and use. Says Vice President of Platform and Marketplace at Change Healthcare. And the expansion in the utility, in the ability of providers to offer telehealth appointments was a systemic change, forcing providers to rethink how they operate. This includes the underlying availability of technology that enables telehealth, regulatory restrictions being lifted, and emergency measures with the passage of the CARES Act, recognition from provider organizations that this was a better way to serve the healthcare consumer, and not surprisingly, increased demand by patients. The pandemic forced us to take a hard look at all the places where in our healthcare journey, as patients, as providers, as insurers, the gaps existed. Shah says, telehealth is a shining example of how we rapidly embraced a virtual care model through legislation, through technology, and through connectivity. With recent moves by Amazon, Walmart, and United Healthcare Group in the space, it looks like telehealth will continue to grow. And this expansion will require breaking down long-standing information silos that have blocked up patient data in scores of places, from the hospital to primary care offices to specialist practices, diagnostic facilities, and more. It's a pretty long article. Wow, this is a really long article. What's some big takeaways here? APIs are the intelligent integrations that enable all of this functionality at scale. APIs connect disparate systems to enable seamless data sharing and communication. That's key to keeping pace in the digital era. 90% of healthcare organizations see APIs as mission critical or very important. A Change Healthcare API study revealed, demonstrating that APIs are emerging as the backbone of the digital health economy and will tip the balance when used at scale by 2023. 100% agree. If data is the bedrock that we build this house on, the APIs are the foundation. Thing is, you need people who know how to effectively implement the APIs, The APIs are how we make these experiences work, how we share data, how we provide connectivity to all the different systems in place. Anything else? Yeah, using APIs enables healthcare startups, hospitals, health plans, and other healthcare-focused businesses to more rapidly develop innovative products and services while meeting regulatory requirements and advancing the healthcare industry's adoption of modern open interoperability standards. The use of open standards mean the API and services can be readily deployed across the entire healthcare ecosystem, internally and externally, to help reduce the time and costs associated with many health information technology deployments. Over time, Change Healthcare expects to have hundreds of open standards-based APIs available that represent the company's comprehensive portfolio of healthcare IT solutions, as well as API-based solutions for its partners. Okay, what else is interesting here? How payers benefit from APIs. Yeah, this is big. APIs would definitely help in the payer space. Things like back office processes, like checking eligibility, processing claims, and providing payments are relatively automated behind the scenes, but they're disconnected. Timed together with healthcare data and APIs create a flow of financial transactions that allow the back office to operate more efficiently and process claims in the right way. It simplifies and automates processes and improves transparency. The payer can determine more quickly what a patient owes, and the patient has that information up front. Okay, lots of good information. Is there anything else that comes here? There's a lot of pitching. I just keep seeing Change Healthcare referenced. Explore API solutions. I don't see anything else. I guess there wasn't anything super novel in there. I think most of us know that APIs is a game changer, especially the FHIR API, which is part of the regulations in the 21st Century Cures Act. All right, let's go and share back the original window to finish out the article. Population health topics. Biden's global vaccine strategy draws scrutiny ahead of G7 pandemic talks. President Biden is set to take the global stage this week with a coronavirus vaccine sharing strategy that has been panned by congressional Democrats and some health advocates as too timid, drawn flack from European allies as too bold, and led to frustration within his administration. I have not been keeping up with what's been going on. And this is under a paywall, so I can't even read more about it. Let's move on. Americans split on workplace vaccine mandates. That's a really tough one. As much as I am for vaccines, I'm not a big proponent of mandating people to do certain things. And it is pretty hard to mandate vaccines in the workplace. Some places it's easier. If you're in a healthcare organization, I feel like maybe yes. I even at that point, I still feel that people should be able to choose. That's their own individual right, even though I am very pro-vaccine. Americans are narrowly divided on whether companies should be allowed to require employees to prove their vaccination status before returning to work in person, according to a new poll. Yeah, I don't think that's unexpected. Mandating vaccines in general, or anything that goes against one's individual's rights, is certainly to bring about debate. COVID-19 contact tracing had little impact on population health. This is very unfortunate. Contact tracing was largely ineffective in slowing COVID-19 virus transmission and improving population health, mostly due to insufficient interview responses. What does that mean here? I'm kind of curious about this. So let's just take a look at this a little deeper for a brief second. What exactly was the failure in contact tracing? Contact tracing, by the way, is a very proven method in reducing transmission of transmissible infections. So I'm kind of curious. There's so many variables here why it could have failed, but what exactly did they show here? Mostly due to insufficient interview responses. What does that mean? In an analysis of over 74,000 cases between June and October of 2020 from 13 health departments and one Indian Health Service unit, researchers found that 2 of 3 people with COVID-19 were not reached for an interview or did not name any contacts when interviewed. Public health authorities reached a mean of 0.7 contacts by phone, and only 0.5 contacts per case were adequately monitored. In this cross-sectional study of U.S. local COVID-19 surveillance data, testing named contacts was a high-yield activity for case finding. Despite this, the lack of interviewing and naming contacts made the process of contact tracing largely ineffective in improving population health. Yeah, these things are really important because right here, it impacts the allocation of resources. So this might not be something that they put more funding towards in the future in terms of prevention strategies and use towards other things. Contact tracing challenges include a lack of response to calls from public health officials, a reluctance to share contact names for fear of subjecting others to quarantine, and mistrust of government. Of confirmed COVID-19 cases in the cohort, 59% participate in interviews while 33% named contacts. However, 44% did not name any contacts. Wow. There's a very low percentage in those that had COVID-19 cases. You can see why it failed. Health departments with the highest case counts conducted significantly fewer interviews than those with low case counts. Let's see, what else is that down here? While contact tracing in this instance did not have a significant impact on population health, the healthcare industry has been researching and investing in other innovative methods of slowing the spread of COVID-19. A recent opinion piece published in JAMA Network explored the use of precision medicine in treating and reducing negative health outcomes of COVID-19. Despite its promise, researchers found that, like contact tracing, precision medicine's use for COVID-19 treatment depends on successful logistical efforts to streamline the process, including standardized taxonomy and subtypes. While the entire healthcare industry is working on innovative ways to treat and control COVID-19, the sheer volume of cases and other external barriers are proving to be difficult to overcome. Yeah, I mean, there's so many other variables that likely impacted the success of contact tracing in general. Big on it, like you're usually contacted by a public health official, and the mistrust of government, I feel, was so high in 2020 that who wanted to work with government at that time? It was just not very trustworthy. It was not handled very well during the pandemic. And I think there was probably a shortage. I actually, fun fact, applied to be a contact tracer because I really wanted to help out in 2020. And I ended up not doing it because I was so busy. But it seemed like they were in huge need. They just were recruiting COVID-19 contact tracers like left and right. They could not find enough people to fill positions. Crazy. It was crazy. All right, so we're nearing the end. Is actually perfect. So let's see. 4SDOH driving health disparities in patient portal use. As patient portal use and access become more commonplace in healthcare, it would be prudent for health IT leaders and clinicians alike to understand the health disparities that can emerge with patient portal use. Not a surprise. They actually, I saw an article the other day from Jamie talking about how there's a digital divide, especially when it came to the use of telehealth. It really exacerbated those who are less socioeconomically disadvantaged because some people have access to technology and some don't. So this is another example. Some people have access to internet or smartphones or whatever, where they can access their patient portal, and some don't. It kind of makes sense that there would be some divide when it comes to using technology. Johnny Malner, what's up, Johnny? Johnny says, I wasn't interested, but you make telehealth look so good. Why is that, is that sarcasm? I feel like I just like crapped on telehealth the whole time. Mui says, hi, Brian. What's up? This is actually the end of my session. Tony says, another good session. Thanks, guys. Seems like everyone's like trickling at the end. I'm not going to advertise these anymore. I'm just going to like go and talk about them in the future. These are just kind of learning sessions for me, and I figured I'd share with other people the news that's going on when it comes to pharmacy and informatics. But that's it, guys. I usually just do these from 8:30 to 9, 30 minutes every week on Wednesdays. Thank you guys for tuning in. I will see you all next week. Bye, guys.